Hi, my name is Claire. I'm going to be filming my tracheostomy care video. So I'm going to start by checking the orders for tracheostomy care and suctioning, gathering my supplies, checking the patient's chart for allergies, that it's an appropriate procedure. So I'm going to enter the room. Hi, my name is Claire. I'm going to be your nurse for today. Could I get your name and date of birth? Checking the wristband. All right. Performing hand hygiene. Providing privacy with the curtain. And so for today, we're going to be doing some sectioning on your tracheostomy and then changing the dressing and cleaning it. And I'll have already done a respiratory assessment, taken vital signs, taken a pain level, pre-medicated pain medication if necessary. And can I ask if you have any allergies? Allergies, okay. And my equipment is at the bedside. At this point, I'm just going to put on some gloves. Just checking the pulse ox here. Just going to listen to the lung sounds. Oh, accidentally threw that away. Just going to get another one. Cleaning my equipment. All right, just going to do a quick respiratory assessment again. All right, cleaning my stethoscope. Okay. And now I'm going to get the bed to a comfortable working height. Just going to move that out of the way. And just making sure I have all my supplies. The patient is being oxygenated while I'm setting up here. Just making sure my suction is working. And the suction is going to be going at 80 to 120 millimeters mercury. And now I'm going to go get my sterile field set up. Before I do that, I'm just going to put a drape on the patient. Performing hand hygiene. Checking the length of the catheter. A bit of saline in here. And hygiene. maintaining my sterility. This will be my clean hand. This will be my sterile hand. Okay, and the suction would be on at 80 to 120. But for the purposes of the video, it's kind of loud, so I'm just going to leave it off for now. Actually, I'm going to turn it on. This is, yeah, I'm just going to use my elbow here. Okay, haven't broken sterile field. 80, or it is at 105. Suction is on. I'll lubricate with the saline. Right. All right. Gonna move the oxygen out of the way. Just gonna do the saline and checking to make sure it's working. And I'm just gonna advance it until I feel resistance. And I'm not going to apply suction while doing that. Okay. Using a twisting motion for 10 to 15 seconds, keeping on the pulse ox. Okay. And if the need for further suctioning is there, I would hyperoxygenate and suction up to 2 more times, but the patient does not need further suctioning. So going to set this aside. And gonna put the oxygen back on. Taking this off, making sure the vitals are good, and hand hygiene, and just keeping an eye on the patient. How are you doing? Doing okay? I'm just going to keep that same drape on there. And now at this point, I'm going to, as part of my supplies, okay, so now I'm going to, okay, so I'm going to go ahead and clean off your trach. We've already removed the old dressing, and now we're just going to go ahead and clean it. Apply new dressing, take care of that. and then we'll be good to go. Okay. Set up my sterile field. Just keeping a 1-inch border. And before I put those on, I'm just gonna get my saline ready because the outside of the saline is not sterile. So, and yeah, so putting it in the rinse and the wash, keeping one dry. Okay. All right, now we can put the gloves on. And hygiene. Got these nice sticky gloves. Pre-soaking. And already removed the dressing. Okay. So clean hand, sterile hand, then the oxygen. Rinsing or cleaning. Drying. And now I'm just going to set that there for a moment. And all right, now that it's dry and clean, I'm going to reinsert it. And now I'm just going to clean circular motions. In a real person, this would be a little bit easier. Mannequin, it's a little bit tricky. Okay. Going to rinse. And patting that dry. Try not to manipulate the trach too much. Now applying a new fenestrated drape. A little bit tricky. There. All right, time for the new tie. Loop it in half. Making sure it's not kinked or anything. You could lift your head up for me. All right, square knot. Now removing the old dressing, the old tie, I mean. Okay. That's that. All right. I'm gonna throw away my supplies. Discard everything. All right. Now I'm going to document my findings. Move that, put it back to oxygen. And document my findings, call light within reach. With all my supplies from hand hygiene. That concludes my video.